Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Today, in the third episode of our series on the treatment of small cell lung cancer, we look at care coordination for multidisciplinary teams. AdventHealth has a new lung nodule clinic, and they're able to diagnose small cell lung cancer earlier because of care coordination. Our guests today are from the AdventHealth Cancer Institute in Tavares, Florida. They are Dr. Ryan Schroeder, a pulmonologist, Dr. Ahmed Al-Hazzouri, a medical oncologist, and Dr. Justin Wu, a radiation oncologist. Thank you all for joining me today. AdventHealth's Lung Nodule Clinic was designed to be a community resource and to better diagnose lung cancer. Dr. Schroeder, how has this approach impacted the number of patients seeking treatment?
So yes, the other effect of having a lung nodule clinic is that it serves as kind of a beacon for marketing and a beacon for outreach to the community regarding lung nodule screening. So unfortunately, here in Florida, when it comes to low dose CAT scans of the chest, the utilization of it is very low, meaning that the group of people who could get low dose CAT scans of the chest do not. Only about 3 to 5% of people who qualify for low dose CAT scans of the chest actually get it here in Florida. So the Lung Nodule Clinic is a way for us to also, provide this community outreach through the clinic and say, not only should you get screened, educate the public about being screened, but we can help you if there's an abnormal finding. So it's meant to kind of encompass the full cycle of care for a patient or the line of care for a patient, kind of down this pathway in as quickly as possible for them.
Dr. Wu, do the patients treated in the clinic come from both inside and outside the community?
Absolutely. So with the advent of the lung nodule clinic that Dr. Schroeder has been instrumental in setting up, the goal is to catch all lung cancers at an earlier, more treatable, more curable stage by doing low-dose CT scans to, again, screen patients who are particularly at high risk of developing either small cell or non-small cell lung cancer, i.e. those who have a prolonged smoking history. So, and that clinic has been really wonderful and instrumental in achieving that goal. And we attract patients from both from the immediate area around Waterman Hospital, Tavares, Eustis, Mount Dora, but also surrounding counties as well.
Dr. Wu, I'd also like to ask you about the treatment barriers facing this patient population. How can care coordination among the multidisciplinary team help overcome these?
I think that's a great question, Summer. So one key thing I think is financial. I think if patients are unfortunately indigent, then one huge barrier I think is lack of insurance. So patients may not seek screening in the lung nodule clinic. They may not come for treatment because of at least perceived financial barrier to come for treatment. Because of course, all these up-to-date latest cutting edge treatments are very expensive. And so patients understandably are very hesitant. Can I afford these very expensive treatments, whether they be radiation, chemo, immunotherapy, surgery, et cetera? So again, we have a very strong social worker program and financial counselor program in place that meets with every single patient, both the financial counselor as well as social worker, to help overcome any perceived real or unreal financial barrier that may or may not exist. If patients don't have insurance, we can help enroll them in appropriate insurance or enroll them in Medicaid at least. We have various charitable programs as well, so that if patients are unable to be enrolled in an insurance plan, there's charity care, there's different payment plans. So again, it's a comprehensive program. Radiation is tough because if patients have more advanced stage disease and don't qualify for the short course of stereotactic body radiotherapy, if they need more like 4 to 6 or 7 weeks of radiation, coming back and forth every day can be really tough on a patient logistically, in terms of transportation and expensive gas, et cetera. So we help with gas cards. We help set up transportation when a family member or friend is not able to provide that. So we make things as easy as possible for the patient, again, with the goal of trying to remove any logistical barrier to treatment.
Dr. Al-Hazzouri, we'll go to you. What role does community outreach and marketing play in educating patients?
Um, One of the major, especially in a rural area such as ours, where you can argue we're suburbs, you can argue, there's places that are rural in our county, in our catchment area. One of the major hurdles of care is access. Not our many patients can drive to a big institution, that is an hour away. Some of them, if not all of them, work. They have family. Insurance may be an issue, or just lack of knowledge that they can potentially access these centers. And so being in the community and having a community outreach, going to them, making the first step rather than the other way around, goes a long way in building trust, in making sure they're aware of the programs available in their backyard, and making sure that if we're not aware of what's a reason why they're not seeking healthcare to prevent lung cancer, that we put it as a top priority to us, and we develop plans to overcome whatever feedback we get from our community. It's a two-way streak.
Dr. Wu, can you talk about the important role of the lung nodule navigator?
So having the lung navigator is a vitally important piece in our cancer program. You can imagine that if you're a patient, this is all totally new and foreign and alien to you. Um, you know, all the terminology, all the acronyms, all the various treatments and side effects. It's incredibly scary and intimidating. So the lung navigator plays a vital role of really helping calm a patient's fears and anxieties, filling in information, getting them connected with the proper people to remove any barriers to treatment, such as a financial counselor, social worker, helps explain the various steps in the process, what's involved with a low-dose CT scan, what's involved with a CT-guided lung biopsy, what's involved with radiation and chemotherapy and immunotherapy treatments and surgery when appropriate. Again, it's a very scary process with all sorts of unknowns. And so the lung navigator really helps provide continuity of care throughout the whole process.
Dr. Al-Hazzouri, how has the addition of the nurse navigator role improved care coordination?
Yeah. It's again, it's been a great help. Think of what she does is the grease between the wheels. It makes everything move faster and smoother. Instead of, we're all physicians are pretty busy, and we prioritize our patients, and sometimes a lung nodule that needs appropriate follow-up may not take priority over another patient that is, in crisis care. That doesn't mean they're less important. It's just, as a physician, you have so much time that you have to figure out, how to spend, and you prioritize patients. And so the nurse navigator has been a great addition to our team in making sure that when we determine that a patient needs either follow up with the lung nodule clinic or a biopsy, or potentially seeing an oncologist, that the work that happens behind the scene, is done fast and right, in the most optimistic succession fashion way, kind of thing. And so, when the patient comes to see me, instead of seeing a lung nodule that I don't know if it's cancerous or not, that patient has already been worked up, potentially has had the biopsy, and I have a diagnosis so we can start treatment as soon as possible. This is really important, especially in the community setting, where we may not be all in one institution, where we may not have the same electronic medical record, we may not have the same physical location. So the nurse navigator has kind of lifted the barriers that all these things could put in front of patient care, has lifted them and made sure that even though we may not be in one institution, one healthcare system, one medical record, that we act as one team and we deliver the care that the patient needs.
Dr. Schroeder, how important is it for care teams to track data regarding patients' progress?
I think it's vital because that's what lets you know that you are successful. Otherwise, what is the point? The point is to show that you are improving the stage of diagnosis, meaning that, right now here in the state of Florida, about 40% of people, when they're diagnosed with lung cancer, are diagnosed at late stage disease, where, they have a very limited prognosis, and, surgery is not part of the treatment. Therefore, they will never be cured. With proper lung cancer screening and then rapid diagnosis and management, if you catch these lung cancers earlier, you can cure them of cancer. So tracking is how you know that you're doing this appropriately, that you're seeing return on your investment for the resources and time that the physicians and the staff are putting into this. And it also helps you identify if you're not, what the problems are. Where are you losing the time? Where are you losing the patients in the testing to get done?
Thank you, Doctors Schroeder, Al-Hazzouri, and Wu, for sharing this information with us. You can head to the show notes or visit the ACCC website for more resources on the treatment of small cell lung cancer. Be sure to check out the rest of the episodes in this series on care for small cell lung cancer. Links to those are in the show notes as well. Today's episode was made possible by funding through AstraZeneca and G1 Therapeutics. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.